Hmm. Hello everyone. Let's start with the first chapter, that is anatomy of female reproductive organs. So, coming to the first thing, what are the functions of the reproductive organs? First function, it is copulation, that is intercourse. Second, fertilization, that occurs in fallopian tube. Third, that is growth and development of fetus, and also its childbirth. Okay, so what are the reproductive organs? It can be divided into external genitalia, that is what is visible outside, that is the external genitalia. Internal genitalia, that is present inside, that is present in the pelvis, and other accessory reproductive organs. I will be telling you in details about each of this, that is the external genitalia, internal genitalia, as well as the accessory reproductive organs. First, let's see what constitutes external genitalia. External genitalia, I will show you a picture. First you understand with me. Okay, this is a picture showing the external genitalia. What is external genitalia? External genitalia, it is the structures that are visible outside the female, means it is, see, this one you see in the picture, it includes all the visible external genital organs, okay, that lies in the perineum. So first, here it is mons pubis, this one, it is the mons pubis here. What is this? I will be telling you in details. Just see, just look at the anatomy. Here it lies the mons pubis, that is the subcutaneous fat that is present in a triangular shape. Okay, then clitoris, see, this one is clitoris. Then labia majora, here is the labia majora. Okay, labia majora, anteriorly it merges with the mons pubis, and posteriorly it forms, here posteriorly it forms what? Posterior commissure. Okay, then which lies here, it is the posterior commissure. Okay, here this one, this part, it is the posterior commissure, and this posterior commissure lies between the fourchette and anus. Okay, so don't confuse it with fourchette. Fourchette is the continuation, or when the labia minora, that is here this one, labia minora, when it joins posteriorly, it forms the fourchette. So fourchette is different, posterior commissure is different, and vestibule is different. So what is vestibule? Vestibule, it is a triangular area where urethra and vagina openings are present. So this one is the urethra, urethral meatus, and this one is the vaginal introitus. Okay, and here it is the hymen. It's a membranous structure that is present. Okay, so first coming to external genitalia, and also remember, let's write something about external genitalia first. External genitalia, it includes all the visible external genital organs that are present in perineum. This is the first. Second, it consists of what I have told. First, write this one, mons pubis. Second, labia majora, labia minora, hymen, clitoris, vestibule, urethra, skin glands. What are skin glands? I will be telling you in details. Skin glands are the paraurethral glands. Okay. Skin glands are the paraurethral glands which is present along the side of the urethra. And then ninth is Bartholin glands, and Bartholin glands are not present outside. Okay, the Bartholin ducts, the opening of the Bartholin ducts are present in external genitalia. Okay, and then 10th is the vestibular bulb. Okay, so remember all this. First mons pubis, here it is mons pubis, then labia majora, then labia minora, then clitoris, then vestibule, urethral opening, vaginal opening, posterior commissure, fourchette. Okay, and then skin glands, Bartholin glands, or opening of the Bartholin glands, that is Bartholin ducts, and then vestibular bulb. Okay, fine. Then next, here also it is another picture showing what this, it is marked well. Okay, labia majora, then here is the labia minora. Okay, then green one is the vestibule, where there is presence of urethral as well as vaginal opening. Here is the clitoris, and this is the clitoral hood. Okay, I'll be discussing about the clitoris in detail. Okay, and here is the anus, and this is the posterior commissure. Okay, where the labia majora, it joins posteriorly to forms the posterior commissure, which lies between the anus and the fourchette. Fine. Then coming to the mons pubis. So what is the mons pubis? I have shown you here. Let's write something about mons pubis. Okay. So first, coming to mons pubis, it is a pad of fat or subcutaneous tissue that is lying in front of pubis. Okay, so what is the shape? Shape is inverted triangle. Okay, inverted triangle like this. Okay, this is the apex and this is the base. So base is pointing where? Base is pointing upwards. Okay, so base is directed upwards. So it is a subcutaneous tissue or fat which is lying in front of the pubis. Okay, and shape is inverted shape. Okay, means the hair follicles that are growing, that is in shape of a inverted triangle. Right? So is it covered by hair or not? Yes, it is covered with hair. Okay, then next, coming to the labia majora. Let's write something about labia majora first. It is a structure that on each side of vestibule. Okay, it is elevated. Okay, elevation of skin and subcutaneous tissue. So here also, is the hair follicles present or not? Yes, hair is present. Okay, then point. It continues medially. I have told you previously, it continues medially. Okay, posteriorly it forms what? Posterior commissure. Posterior commissure. Okay, and anteriorly, where? Here it continues posteriorly. Okay, medially it continues posteriorly to form posterior commissure in front of anus. Fine, just remember the diagram here. What I've told you, here is the posterior commissure, this is the labia majora. Okay, this joins posteriorly to form posterior commissure. Fine, and anteriorly it merges with the labia, sorry, mons pubis. Okay, then next, write this much. Labia majora continues medially and goes posterior to form the posterior commissure in front of the anus. So it's complete. Next, it is covered with squamous epithelium. Contains sweat glands, rich with venous plexus. I will tell you the importance of this one. Rich with venous plexus. Right, just write this. Okay, so what is the significance of venous plexus that lies in the labia majora? Okay, here during the episiotomy, during normal vaginal delivery, when we give episiotomy and during its repair, okay, first when you give the episiotomy, the venous plexus gets damaged. Okay, during episiotomy. When during repair, you don't suture it properly or proper hemostasis is not achieved, then it can lead to vulval hematomy. Okay, fine. So this is a very important, it is very critical condition. We need to manage it properly. Okay, we have to open the wound and then again we have to suture the plexus and then proper hemostasis we have to achieve, and then we can get rid of the hematoma. Okay, if we leave it for long time, then what will happen? If we leave it for long time, then patient can collapse due to blood loss. Okay, then coming to the labia minora. Okay, what are labia minora? I've shown you in the picture. That is, they are the two thin folds of skin. Okay, that is devoid of fat. Devoid of fat. And does the sweat gland is present here? No. Okay, no sweat glands. Only thin skin fold. Okay, which lies medial to labia majora. Fine. So anteriorly and relation. Okay, the labia minora anteriorly it divides. Okay, it divides. Who divides it? Clitoris. So here clitoris is present and anteriorly they unite with each other in front of the clitoris and forms the prepuce, and behind the clitoris it forms the frenulum. So let's write it down. Anteriorly it divides, okay, to form prepuce in front and frenulum behind the clitoris. Okay, remember this one also. and posted, this one in front and behind the clitoris, okay, not posteriorly. And posteriorly it forms, I've told you before what it forms. Posteriorly it forms fourchette, okay. Just below the fourchette, what is present? The termination of the labia majora, that is posterior commissure, okay. And then just below that, there is presence of anus. Fine, done. Okay, now let's move to clitoris. What is clitoris? It is an erectile body. It is very small, okay. There is presence of numerous neural plexus, okay, that helps to achieve what? Orgasm during intercourse. So it is a very important part that plays a role in female intercourse, okay. So let's write it about. It is an erectile body, very small. What is the size? 1.5 to 2 centimeter, and numerous neural plexus, okay, for pleasure of females during intercourse. Fine. Then what are the parts? It consists of glands like this is, remember, this is homologous to glans penis in males, okay. So it consists of glans, body and two crores. See this one picture, okay. Anatomy of the clitoris and penis. This one, these are the two crores. Here one crura, here another crura. It joins to form the cavernous body, and here it is the glands of the clitoris, okay. Fine. And this one is the spongiosous body muscle. Along this muscle there are two crura, 1, 2, a body, cavernous body here, and then a glans, okay. Fine. Then next, coming to the vestibule. What is the vestibule? I have told you, in vestibule there are opening of urethra and vagina. So it is a triangular space. Triangular space which where there is opening of one urethra and second vagina, okay. And also Bartholin ducts. And around urethra, what are there? Skin glands. So you can also write skin glands, also called as paraurethral glands, that is present alongside urethra. Fine. Vestibule. This is vestibule. And also let's see, it is a triangular space, okay. So anteriorly what is present? Clitoris. I will show you in the diagram. I will show you. Posteriorly what is present? Fourchette. And laterally labia minora. I will show you. Wait, I am showing you. Here, this is the vestibule, okay. What is present anteriorly? Clitoris. What is present posteriorly? Posteriorly, fourchette. Okay. Laterally, labia minora. And what are the openings? Urethra and vagina, and along urethra, the paraurethral glands or skin glands. Okay. Paraurethral glands are also called as skin glands, and presence of Bartholin ducts. Opening of two Bartholin ducts. Fine. Okay. Understood? Now let's come to Bartholin glands. Coming to the Bartholin glands. What are the Bartholin glands? Okay, these are the two greater vestibular glands. Okay, what are the functions? These are the greater vestibular glands. Number, 2 in number. Where is its opening? See, this one is the gland. Okay, this one is the opening. Okay, this is the Bartholin gland, and this is the Bartholin duct. So you will see the ductal opening in the vestibule, not the gland. Gland is present inside, okay, in the interior part, and then you will only see the externally the opening of the duct, okay, which is 2 in number. And where is it present? The Bartholin gland. It is present just inner to superficial fossa. Where it is present in superficial perineal pouch, superficial perineal pouch. Okay, and during, what is the function? Why is it present? During intercourse, it secretes alkaline mucus, which helps in lubrication. Okay, fine. Then in males, it is homologous to Cowper's gland, or also called as bulbourethral glands. Okay, in males. Fine, complete. Okay. Then next, tell me one thing. Why are we studying the external genitalia? Because it is essential for clinical practice, we know, and also we need to know the detailed anatomy so that we can diagnose the infections, trauma, tumors, and other conditions. Then we can perform procedures like DNC and other episiotomy and normal vaginal delivery. We can perform it better. Okay, and also we can identify, if we know the normal anatomy, then we can identify the congenital anatomy, congenital anomalies. Okay, and it is important for reproductive physiology. First, identify the congenital anomalies, okay, and diagnose the infections, trauma, tumors, and we can perform the procedures like DNC, episiotomy, marsupialization. Okay, and reproductive physiology, that is normal vaginal delivery. Fine. Okay, then I will tell you another thing. You know about what is pudendum and what is perineum? Do you know the difference? Pudendum, what is pudendum? Pudendum, it is the things we have studied now, that is the female external genitalia, the genital organs that are visible outside. This is the pudendum or vulva. It consists of all the structures that we have studied now. Okay. So, and what is perineum? Don't confuse with perineum. What is perineum? I will write it down for you. Perineum, it forms the floor of pelvic outlet. Okay, this forms the floor of the pelvic outlet, and this one, it constitutes all external genital organs. It is just a synonym of vulva. Okay, that is the external genital organs, and perineum, it is different. It forms the floor of the pelvic outlet. Okay. And then another thing we can write, it extends from mons pubis to perineal body, but here perineum, it extends from pubic symphysis to coccyx. Okay, so these are the difference between pudendum and perineum. Don't confuse. Pudendum is different and perineum is different. Okay, thank you.